Our next speaker is Dr. Brandi Boan. Dr. Brandi Boan has extensive training that includes her internship at Elgin State Hospital and her neuropsychological training at Rush University and her fellowship in clinical psychopharmacology in the Ascension, Illinois Health System hospitals. Dr. Boan has specifically presented on the importance of outreach and health services in rural areas. And now you'll talk to us about rural health.
Thank you very much. So I'm going to try to keep this short because I've had a cold all week, so I'll start coughing. So first of all, if you have not voted, please vote for Dr. Ron Reimer for APA president. And if you haven't, you have until
September 16th.
September 1st. So hurry up. So one of the things that I tend to speak about is healthcare and the importance of mental health care in rural situations. I grew up in a rural town on a farm, and as many people know, first of all healthcare is predominantly based metropolitanly, but also very much so with mental health care. So in rural areas, there is even more of a need for prescribing psychologists for all mental health care, but especially prescribing psychologists because there's a lack of access to mental health professionals and particularly psychiatrists. In Illinois, most psychologists, well over 60% of psychiatrists, are very close to retirement age or will be retiring sometime in the next 7 years. And if we are truly society that is consumer-based, we should be able to provide patients with the opportunity to pick which type of provider they would like. And prescribing psychologists not only fill the gap in terms of the need and the lack of access out in rural areas and then further lack of access because people are retiring, but then also they should ultimately have the right to choose what type of provider they want. And psychologists that are able to prescribe offer a good ability to present treatment approaches that are holistic and not just medically based, but also more holistically, and then incorporate as appropriate psychopharmacology, and are able to do so much more collaboratively with primary care physicians, with counselors, and take the time to make sure that they are treating the person appropriately. And one of the biggest things that I've stressed is that yes, while we do have the need, we should also be able to give people the opportunity to choose. And that's why it would be very good to continue to have more states that are able to allow for prescribing psychologists and also with less restrictions. I know that we'll talk at some point about the restrictions in Illinois, but particularly out where I practice, one of the biggest difficulties is the restrictions on age and also stimulants for children who might be suffering from ADHD or ADHD and dyslexia, and then they have to wait 6 months to get in to see a child psychiatrist because their pediatrician's unwilling to provide that that type of intervention because they don't have the training, which is very understandable. But by not providing that family with the choice of being able to use a prescribing psychologist who, in our situation, diagnoses the child through testing but can't give the medication just simply because Illinois is one of the more restrictive states, it's just not very consumer-based or really appropriate because we have all of that training. So I know that we have continued to grow throughout the nation in how many states are allowed to, and I hope that that continues to happen, but then also that the restrictions, especially within Illinois, start to slowly go back.
Yeah, we're going to have Mark Taylor's going to talk to us about that. Hopefully, we'll get there very quickly.
So thank you all for being part of this, and then we will, whoever has questions, talk to you soon.
Yeah, wonderful.
Thank you.
Thank you. Thanks so much.